126,000 seniors woke up this January to a letter that changed everything. Their Medicare Advantage plan was gone. Not changing, not raising premiums, gone. Coverage terminated. And the window to replace it? 33 days. That is what happened when Bright Health Group collapsed out of the Medicare Advantage market. And right now, in 2026, it is happening again. A second major insurer has announced it is exiting. More are expected to follow. And if you or someone you love is on a Medicare Advantage plan right now, the letter I am about to describe could already be sitting in your mailbox. In the next 15 minutes, I am going to tell you exactly which companies are pulling out and why, how many seniors are affected in 2026, what happens to your coverage the moment a plan cancels, every deadline you have to act, how the special enrollment period works and the 2 mistakes that can void it, and the single most important comparison you need to make before picking anything new. Most people who lose a Medicare Advantage plan assume they have to pick another Medicare Advantage plan. That assumption costs thousands of dollars a year. The real answer is more powerful. I will show you exactly what it is. Medicare Advantage insurers receive a fixed monthly payment from the federal government called a capitation rate for every enrolled senior. If your medical costs come in under that payment, the insurer keeps the difference. If your costs exceed it, they absorb the loss. Post-pandemic utilization came back higher and faster than insurers projected. Procedures deferred in 2020 and 2021 came flooding back. CMS also tightened the risk coding practices many insurers had used to inflate their payments. The money shrank. The costs rose. And for smaller regional insurers, the math stopped working. The names that have announced reductions or exits for 2026 include Aetna, which exited more than 200 counties, Humana, which pulled back from employer group Medicare Advantage products, and several Blue Cross Blue Shield affiliates that have reduced their rural and suburban footprint. The plans that exit first always follow the same pattern: rural areas, low-income markets, regions with higher than average medical utilization. If you live outside a major metro area, your risk of receiving a cancellation letter is higher than the national average, and the trend is not reversing. CMS data shows the number of counties with 3 or more Medicare Advantage insurers is shrinking. Competition is declining, and when competition declines, the plans that remain get worse. In 2026, more than 33 million Americans are enrolled in Medicare Advantage. That is more than 50% of all Medicare beneficiaries for the first time in history. CMS projects approximately 1.6 million beneficiaries are enrolled in plans that have been discontinued, significantly reduced, or are in counties where the insurer has exited entirely. Let me tell you what that looks like in real life. Dorothy is 71 years old. She has been on the same Medicare Advantage plan for 6 years. Her cardiologist, her primary care doctor, her pharmacy, all in network. Her plan cost $40 a month. Her out-of-pocket maximum was $4,000. In October, she received a letter. Her plan was being discontinued December 31st. She had until December 15th to choose something new. She called the number on the letter. She was on hold for 47 minutes. She hung up. On her third call, she selected a new plan from the same insurer at the only price she understood in the moment. 3 months later, her cardiologist was out of network. Her pharmacy was no longer preferred. Her new out-of-pocket maximum was $6,500. She is paying $280 more per month than she was in 2025. Dorothy's story is not unusual. It is what happens when the decision is made under time pressure without the right information. That is what I want to protect you from today. The most important thing to understand is this: you do not lose Medicare. Original Medicare, Part A for hospital and Part B for outpatient, is federal insurance. It cannot be canceled by a private insurer. When your Advantage plan exits, your underlying Medicare automatically reacts. But 3 dangerous gaps open up immediately. Gap 1, prescription drugs. Original Medicare does not cover prescriptions. When your Advantage plan cancels, your drug coverage cancels with it. You need a standalone Part D plan immediately. Gap 2, the 20%. Original Medicare pays 80% of approved costs. You pay 20% with no cap, no maximum out-of-pocket. For a serious illness, that 20% can reach $50,000 or more. Gap 3, your network. Original Medicare is accepted by 93% of U.S. doctors, but your current specialists may need to verify they accept Medicare assignment before your first appointment under new coverage. Now, here is the protection most people never use. When your plan is canceled through no fault of your own, you receive a special enrollment period. And critically, you may qualify to enroll in a Medigap plan without medical underwriting. The insurer cannot deny you based on pre-existing conditions. That protection normally does not exist. The plan cancellation unlocks it, but only for a limited time, and only if you act correctly. When your plan cancels, you have 2 windows working simultaneously. First, the annual enrollment period runs October 15th through December 7th every year. Any beneficiary can switch plans during this window. Changes take effect January 1st. Second, your plan discontinuation's special enrollment period. When your insurer notifies you of cancellation, CMS triggers a 60-day SEP starting from the date you received notice. Now, the 2 mistakes that void your SEP rights entirely. Mistake 1, voluntarily disenrolling before your plan is formally canceled. If you call and say, "Cancel my plan now," out of frustration, you lose guaranteed issue Medigap rights immediately. You become someone who chose to leave, not someone whose plan was discontinued. The law does not protect voluntary exits the same way. Mistake 2, using your SEP to enroll in another Medicare Advantage plan and then trying to switch to Medigap afterward. Each SEP use is a decision point. If you enroll in a new Advantage plan first and then change your mind, your Medigap guaranteed issue rights may not carry forward. The rule is simple. If you have any intention of considering original Medicare with Medigap, decide that before you make any enrollment move. Do not use the SEP on an Advantage plan first and then try to pivot. Decide direction first, then act. Before you pick any new plan, run these 4 numbers. Number 1, total annual premium. Part B is $179.80 per month in 2026. Add any Advantage plan premium or add Medigap at approximately $100 to $150 plus Part D at $30 to $45 monthly. Number 2, out-of-pocket maximum. Medicare Advantage plans average $5,500 for in-network services in 2026. Some reach $10,000 combined. Medigap Plan G, after a $270 annual deductible, covers virtually everything else. Your maximum is effectively your deductible plus your premium. Number 3, your doctors and prescriptions. Call your top 3 doctors and confirm they accept Medicare assignment. Check your top 5 medications against the formulary of any Part D plan you consider. Number 4, anticipated medical use. If you have a surgery planned or a chronic condition requiring frequent specialist visits, the out-of-pocket exposure under Advantage may exceed what you would pay in Medigap premiums. Real example, a 68-year-old in a healthy year pays $2,100 under Advantage versus $4,000 under Plan G, a $1,900 difference. But one hospitalization under Advantage could cost $4,000 to $6,000 out of pocket. Under Plan G, after the deductible, the cost is $0. Run the numbers for your specific situation. That is the only honest answer. Step 1. Read your cancellation letter and write down 3 dates: when your plan ends, the deadline to select a replacement, when new coverage must begin. Step 2. Call 1-800-Medicare, which is 1-800-633-4227. Ask them to confirm your SEP dates and your guaranteed issue Medigap rights. Get the representative's name and write it down. Step 3. Do not call your insurer's sales line. They are compensated for enrollment and cannot advise you impartially. Contact your state health insurance assistance program, SHIP, at SHIP Health. SHIP counselors are free, federally funded, and earn no commissions. Step 4. If considering Medigap, contact at least 3 insurers and compare premiums for the same plan letter. Plan G is the strongest coverage available for new enrollees in 2026. The plan letter determines coverage. The insurer only determines the premium. Premiums for the same Plan G vary up to 40%. Step 5. If staying with Advantage, use medicare.gov/plan-compare to compare every plan in your zip code. Filter by your doctors and your drugs before selecting anything. Step 6. Make your selection at least 2 weeks before any deadline. Systems get overloaded in December. Give yourself the buffer. Step 7. Once new coverage begins, call your doctors and pharmacy and confirm your new insurance is in their system. Do not assume the transition happened automatically. This section is for anyone thinking it is too late. My plan already ended. I did not know I had options. You may still have a path. If fewer than 60 days have passed since your plan ended, your special enrollment period may still be active. Call 1-800-Medicare today and ask whether your SEP window is open. If more than 60 days have passed, you have the Medicare Advantage open enrollment period from January 1st through March 31st. During this window, you can switch Advantage plans or return to original Medicare. This window does not grant guaranteed issue Medigap rights, but it does allow movement. If you want Medigap and the guaranteed issue window has closed, you can still apply, but insurers may use medical underwriting. Some states, including California, New York, Massachusetts, Connecticut, and Maine, have additional open enrollment protections. Check with your SHIP counselor. If you are currently on original Medicare with no drug coverage because your Advantage plan ended, act on Part D today. Going more than 63 consecutive days without creditable drug coverage triggers a permanent Part D late enrollment penalty, 1% of the national base premium per month, added to your Part D premium forever. One call to 1-800-Medicare can tell you exactly where you stand. Do not stay in your current situation without calling for help. Here is what almost no one talks about during plan cancellations, and it may be the most valuable thing in this entire video. When your Medicare Advantage plan is discontinued by the insurer, not when you leave voluntarily, you receive guaranteed issue rights for Medigap. Most people know this means they cannot be denied. What most people do not know is what it means if you have developed health conditions since you turned 65. When you first enrolled in Medicare Part B at 65, you had a 6-month Medigap open enrollment window. No insurer could deny you or charge you more based on health history. That window closed. If you developed diabetes, heart disease, COPD, or a history of cancer in the years since, you would normally face underwriting, meaning potential denial or significantly higher premiums. A plan cancellation reopens a version of that door. It is a guaranteed issue event. For a 73-year-old with a cardiac history, getting into Medigap Plan G through guaranteed issue rights could save thousands in premiums and tens of thousands in future out-of-pocket costs compared to what underwriting would charge if they could get coverage at all. If you have any health conditions that would normally affect your Medigap insurability and your plan has been or is being canceled, get a SHIP counselor on the phone within 5 business days of receiving your letter. Do not make any other enrollment decision first. This window closes. Once it closes, it does not reopen. Here is what I need you to take away. More than 33 million Medicare beneficiaries are in a system under real financial pressure. The Medicare Advantage market is contracting. More exits are coming. The seniors who recover quickly and make smart decisions are the ones who knew what to do before the letter arrived. If your plan has not been canceled, use this information now. Know your SEP rights. Know what Original Medicare plus Medigap looks like for your situation. Run the 4 numbers. Save your state SHIP program number in your phone. When the letter comes, and for many of you it will, you will be ready. If your plan has been canceled, call 1-800-MEDICARE today. Call your SHIP program. Do not pick a replacement in a panic. Do not let the deadline pressure you into the wrong plan. If this video helped you, subscribe and turn on notifications. Every week, I am here with plain language information about Medicare designed to protect your money, your health, and your peace of mind. Next week, I am covering the 3 Medicare Advantage benefits insurers are quietly cutting in 2026: dental, vision, and hearing, and your actual legal rights when that happens. I am Angela. Take care of yourself, and I will see you next week.